Megan. How are you doing today?
Good. How are you?
Pretty good. What'd you been doing this week?
Not too much. I saw a movie with friends.
Oh, good. What'd you go
it
see?
went well. Oh, we went to see the new It movie.
Oh my goodness, I can't. Nope. Was it as scary as people are saying?
It was for me, but I get scared very easily.
So just so you know, I'm gonna have a timer going, just so we're able to stay on track, and I want you to be able to get the most out of your session. So if you hear a little beep, it's just my phone going on.
Okay.
So you saw the It movie. That seems terrifying, but
Yeah.
I'm glad that you were out with your friends and doing some things. That's really good. So we're just going to continue on with the assessment today. Again, a lot of questions. So if you need a break, just let me know, and we can just kind of take a minute to relax and step back. And if you're not comfortable with the questions, you're not understanding, just let me know, and I can try to explain it more. Or we can move on and come back to that later, if that's okay.
Okay.
So let's just continue on. We had talked a little bit last week about some physical and mental health things. So I just wanted to continue on in that direction. So do you have any history of mental health treatment with psychiatrists, other therapists, case management?
So I kind of avoid doctors.
Okay.
I mean, I go if I have to, and for, like, physicals for work.
Okay.
But, I don't know, just being in a doctor's office makes me really on edge. So
Okay.
I've heard that anxiety meds are helpful to some people, but I've kind of been avoiding all
Okay.
that.
So avoiding doctors because it just kind of increases your anxiety. Am I hearing that right?
Yeah.
Okay. So never any history of going to any type of counseling or case management?
I mean, the school counselor in
Okay.
high school.
In high school.
And then I saw, like, one time I had a really rough semester where I was having some really, like, bad thoughts, you know?
Okay.
And so I went and saw the university like,
Okay.
counseling team, but that was, like, I saw the counselor twice there, and then I was alright.
Okay. So just very brief in high school and then in college again. Okay. Do you remember the names of the providers at the university?
Just the counseling center.
Or just the counseling
Yeah.
center? Okay. Okay. What did you find most helpful in your treatment, either in high school or college?
In high school, I mean, I think I mentioned before, I didn't really have much luck with the, like, coping skills that she was trying to teach.
Sure.
Because I was, 16, didn't really care. I just wanted, like, to get okay, but, like, do it in, like, a normal way and, like, not having to do, like, weird stuff. I mean, I don't think it's weird now.
Okay.
But, like, when I was 16, I kind of didn't want to be different. You know
Sure,
what I
maybe
mean?
a little bit more of the stigma was attached there.
Yeah.
Okay.
Yeah, I think so. And then for, like, the appointments I had in undergrad, it was mostly, like, I don't know, I guess it's embarrassing to, like, talk about, but it's, like, just, like, suicide intervention stuff.
Okay.
So it was kind of, like, a lot of talk therapy, which is, like, I guess it's helpful, because there's not many people I want to burden in that way.
Okay.
So
they helped you kind of get through those in-the-moment crises and able to get past those suicidal thoughts.
yeah.
Okay. So, kind of piggybacking off of that, what did you find least helpful in those situations?
I mean, the school counselor said everything was going to be okay a lot.
Okay. In high school?
No. Oh, well, and both, actually.
Okay.
So, like, the idea, like, oh, you're going to be okay, it's all fine. It kind of, like, added pressure.
Okay.
I guess, to me.
So you felt like you had to be okay because someone was telling you that it was going to be?
Yeah.
Okay. Well, I promise I won't say that to you.
Okay, thanks.
I don't want to put any type of pressure on you to make you feel like you have to be okay. I'm really sorry that they did that. That's not a good thing to do, to put that type of pressure on somebody who is struggling in the moment.
Thanks. I appreciate that.
Of course. So, going more into the physical health side of things, do you have any chronic medical problems at all?
No.
No? Okay. Pretty good health then?
Yeah, I think so.
Okay. So then, any hospitalizations or surgeries for any reason?
Wisdom teeth.
Wisdom teeth, okay.
That's really it.
I remember you mentioned that last week.
Yeah.
Okay, so just your wisdom teeth and nothing else really?
Never broken a bone or anything like that.
Wow, that's awesome. So, and I think last week you also mentioned that you're not currently on any medications?
No.
Okay.
Yeah, like I said, I don't see psychiatrists.
Okay.
It just makes me nervous, so.
Okay. And you're in pretty good health, so you don't need medication?
As far as I know,
Okay.
yeah.
All right. And then what about a history of any substance use?
So, I mean, like, drinking in college was probably more on the binge drinking side when I went out, but I also didn't go out much.
Sure.
So, like, maybe once every couple weeks when my friends could drag me out, but
Okay.
I never, like, went out every week because I was so busy doing everything else, you know.
Sure. But when you did go out, it was heavier drinking?
Definitely, yeah.
Okay.
I think that's, like, a lot of undergrads.
Sure.
Yeah.
Okay.
Nothing, like, out of the norm, I guess, but
Okay.
definitely wasn't healthy.
Sure. So you were drinking, but no drug use, marijuana, anything like that?
I mean, I've tried weed before, but that's really...
But not something that you consistently use?
No.
Okay. Sure. So, when was the first time that you tried weed?
Maybe my sophomore year of undergrad. I just made me really paranoid. I don't want to touch stuff again.
Okay.
Yeah.
So you were about 19, 20?
Yeah.
Okay.
That, yeah.
So it made you paranoid, you said?
Yeah.
Okay.
Just more than usual, which I don't need. So, yeah, no.
Okay.
I'm okay with that.
Okay. And so you haven't used since then?
No.
When would you say the last time you went on one of those heavier drinking weekends?
Oh, not since graduation. So that's like about a year ago.
A year ago?
Yeah.
Okay. So then no inpatient or outpatient substance use treatment, anything like that?
I mean, I've been inside one because of my mom, but I wasn't, like, admitted or anything. So.
Okay. So what do you mean because of your mom?
Oh, my mom, like, she had a history of, like, alcohol abuse, I guess is what you call it. Like, alcoholic seems weird. I never saw my mom as an alcoholic or anything, but, like, yeah. So I'm, like, I guess that definitely wasn't what you were asking. Like, you're any history with, like, substance use, but, like, no.
Okay. So none for you personally?
No, none for me personally.
But in the family?
Yeah.
Okay. So when you were out with your friends in college, did you ever try to cut down on how much you were drinking? Or because it was rather infrequent, you didn't feel a need?
Yeah, more that second.
Okay.
When you were talking about, because, like, I wouldn't drink often, like, maybe twice a month.
Okay.
Like, so I guess it felt to me more justifiable. I mean, now I wouldn't say so. Because I was drinking, like, a disgusting amount. But, you know.
How much would you say you were drinking?
I honestly couldn't tell you. That was, like, a year ago. But definitely too much. Enough to, like, make me disgustingly hungover the next day.
Okay. Did that impact your ability to get to class or work?
I never went out on a night where I had, like, work or school the next morning.
Okay, so you always had the next day to kind of recover from that. Okay, sure. And afterwards, did you ever feel kind of, like, bad about your usage about it, or it was just a way to let loose?
I mean, yeah, like I mentioned my mom, so there's, like, guilt with that. Probably also why. I mean, like, looking back, I probably didn't go out every weekend with my friends because, you know, I didn't want to have the same stuff my mom had, I guess. Well, has.
Okay, sure. And did you ever use the alcohol to begin or end your day?
No.
Okay. All right, so just moving on then. Can you tell me about your current eating habits?
Eating habits. I mean, I guess I could get better about eating because, like, I really don't eat till lunch break at work or break in school, but sometimes I'm, like, too busy to do that, so I, like, eat at night.
Okay.
Yeah. So I'm not super consistent, which I know I need to get better on. I know, like, eating regular meals is important, but...
Yes, it is.
Yeah.
So you said you usually don't eat until lunch, so you're not eating breakfast?
No. I don't really have time. I mean, I have time. We talked about that last week, but, like...
Yeah. You're using that time to be getting ready in the mornings?
And, yeah.
Okay. And so then how much do you think you're eating? Like, are you eating a full meal?
Yeah, I definitely say a full meal at night. Okay. I'm starving by dinner, so yeah.
So if you skip lunch and breakfast, you're eating a full meal.
Mm-hmm.
What about during lunch?
During lunch, if I'm eating lunch, then, like, it's something quick, like a wrap or something.
Okay, so not a full lunch, just like a sandwich or a wrap, you said?
Yeah, like
Okay.
sometimes like a protein thing too, like a shake or whatever.
Okay.
Like Smoothie King does a protein shakes that are
Okay.
really good. Yeah. I mean, like sometimes like a salad. Like it's mostly like kind of a one item thing packed with a lot of stuff that I can like, do quickly. So yeah.
Okay. So you're getting some nutrients, but it's smaller and sounds like pretty healthy usually, a protein shake or
I
just
try
salad.
to. Yeah.
But then it's good you're eating the full meal at dinner because
Yeah.
you said you're pretty hungry by the time
Yeah,
you get there.
for sure.
Okay. And are you snacking in between, or is it usually just the meals?
I usually don't snack at work or school,
Okay.
so usually not. I mean, on the weekends maybe, but like that's like at my house.
Okay.
So yeah.
And then what types of foods are you eating? Do you think you have a healthy, unhealthy diet?
I think everyone can get healthier. I
Sure.
guess. I mean like chips and stuff when I'm snacking
Okay.
probably isn't the most healthy, but I wouldn't say I'm like super unhealthy.
Okay.
So
Kind of in the middle somewhere.
yeah.
Okay. So then what about your sleep? We had talked about it a little bit last week.
Yeah.
You're not getting a whole lot, right?
Not as much as I would. And I think I would need to.
Okay. How about this past week? How has it been? Pretty typical?
Yeah.
Okay.
I didn't sleep much last night, just like, I mean, like, I like you. It's not like I was nervous to come here, but, like, I was nervous to come here, I guess.
Okay. How many hours do you think you got last night?
Maybe 3.
3? Okay.
Yeah.
Was that a block of 3, or you were falling asleep, waking up, falling asleep?
I think, like, a block of 3 and maybe, like, 15 minutes here and there before I could fall asleep, you know, like, on and off, and then, like, at least 3 solid hours.
Okay. And is that pretty typical for every night, or?
Nights when I have, like, something going on that's not in my usual routine.
Okay.
Yeah, I'd say so.
Okay. So when something is out of the norm, like this appointment or anything else, really, you're getting about 3 hours?
2 or 3, yeah.
2 or 3? Okay. What about on nights when your schedule the next day is normal and you know what you're going to expect?
Like 4, I
Okay.
think.
So
Around
not
4.
significantly more?
Not a ton more, but it's, at least I feel more rested,
Okay.
I'd say. So I'm probably getting, like, more of those, like, 30-minute things in between.
Okay.
And then, like, solid 4 hours.
Okay. So then in the mornings, when you do have something kind of unexpected, you're not feeling very rested?
No.
Okay. Okay.
It's more just that, like, on edge all the time feeling.
Okay.
Yeah.
Okay,
I think
sure. And then when you do have your normal schedule, a little bit more rest?
Yeah.
Okay. What about, like, do you dream at night? Do you have nightmares at all?
I've had nightmares. Yeah, I'd say, like, maybe, like, 4 out of 7 days. And that's, like, if I'm... I actually don't know, like, how, like, when they came or where the nightmares come. Just, like, I think, like, 4 out of 7 days having nightmares that, like, wake me up.
Oh, you wake up from them?
Yeah. When I have a nightmare, I wake up. I mean, I might be having more nightmares, I just don't remember. But, you know. And it's not, like, always 4 or anything like that. But it's just, like, pretty consistently a couple nights a week.
Okay.
Waking up from that.
Okay. And then those days are you feeling less rested?
Yeah.
Okay. I can definitely see how that would affect your sleep. Okay. So sleep is an area then that you're probably wanting to work on.
Yeah, I would love to.
Okay. And then what about your exercise routine?
So I, like, go on walks, I guess.
Okay.
I've started doing that more. I mean, we talked a bit about something like that last week, so I, like, tried to this week. And it was a nice escape sometimes, but then it started, like, I guess, I don't know if it's called, like, spiraling or something.
Okay.
Like, kind of, like, getting on a thought and, like, running, and then I was like, okay, I gotta get home.
Okay.
But, well, when it works, I think it worked pretty well. I went on, like, I'd say 4 days. I took a walk. Some of those were, like, on my lunch breaks at work.
Okay. And how often would you say that you were kind of getting those anxious thoughts and then spiraling down?
I do that a lot.
Okay.
I don't know if I could put, like, a number to it or anything. They just kind of, like, get stuck in my head and I can't get it out of my head.
Sure. Okay. And those happened on the walks? You were talking about that you kind of had to turn around and go back home?
Oh, yeah. Not all the walks. There was, like, the first walk I did, like, I think went pretty well.
Okay.
It was kind of nice to, like, get out of the office and, like, get some fresh air.
Sure.
The fresh air was definitely nice. But, yeah, if I, like, got stuck on something, I just, had to stop walking because I felt like I wasn't being, like, productive, I guess.
So the walking wasn't necessarily a helpful coping skill to get you out of that anxious thought?
I don't think so, because, again, like, I felt, like, unproductive.
Okay. So what would it mean on a walk to be productive?
I guess, like, getting to a place, like, not just, like, walking, but, like, walking to a certain end, I guess. I think, I guess I could do that. I mean, it sounds stupid, but I don't really think about that, but yeah, I guess that would be productive.
Okay. And how long were you walking?
The first time was about, like, 30 minutes, because I have a 30-minute lunch break, so, like, they're usually 30 minutes.
Okay. Do you have any other type of exercise at home or anything? Do you go to a gym?
I used to, but I kind of fell out of it after I graduated.
Okay.
I just had to find a gym. It was nice when I was in university, because I, like, had the gym as a part of my, like, tuition, so.
Sure. Do you not have that as a grad student?
I, like, opted out of that stuff. Yeah.
Just to
so
decrease your fees?
Yeah.
Okay. Sure. So about 4 days a week, walks about 30 minutes.
Mm-hmm.
Do you want to get back into an exercise routine?
Yeah. I'd like to, just to stay healthy.
Okay.
Yeah.
Does it help decrease your anxiety at all?
Yes and no, because sometimes I feel like I get hooked on, like, I have to do this, because I don't, for a while in undergrad, it felt like I had to be exercising to, like, maintain, like, a certain, like, body type, and I felt like that wasn't healthy, and it just kind of, like, made my mood worse.
Okay.
And it was kind of, like, during that really bad semester, basically my last semester of undergrad was pretty rough. Yeah.
Okay. So hopefully maybe trying to get back into a routine, but are you kind of happy with what your exercise is right now?
Happy enough. Like, I'm not anxious about my weight, I don't think. I was in undergrad, and I don't really want to get back into that. So if I could exercise and not freak out about doing it every day, then yeah.
Okay, sure. So now we're going to move into a risk assessment. There's our timer, but we still have a little bit of time.
Okay.
So if you need a break during this at all, just let me know. We can go ahead and take that.
Okay.
So you had mentioned that I think you said your last semester of college, you were having a really rough time. Can you explain that a little bit to me?
It was like, because I, like, had kind of a plan, I guess, for what I was going to do.
Okay.
But also didn't, and it was just, like, a lot of pressure and uncertainty, and I just wanted it to go away. I think back then it was, like, my easiest way out was to end my life. I don't feel that way anymore, but at that time it was, like, just a lot of everything.
Okay.
And it was, like, too much to handle. But, like, talking with the counselor, like I said, that kind of helped me get out of that mindset.
Okay. So you would have been about 21, 22,
yeah.
Right? Okay.
21, yeah.
21, okay. So you were feeling the pressure and you felt like the escape then was to end your life?
Yeah.
Okay. And you mentioned that you did have a plan. Do you mind telling me about that?
Oh, not a plan to commit suicide. Sorry.
Okay.
I meant, like, a plan for my future.
Oh,
okay. Yeah. So, like, a lot of the reasons I was feeling down is because I felt really pressured because graduation was coming up. And I had a plan for my future, but also didn't because there's so much uncertainty. That's what I meant. I didn't mean I had like, a plan.
I'm sorry, I misunderstood that. So, what types of thoughts then were you having when you were having these? You said suicidal thoughts, but was it thinking of ending your life? Was it thinking of harming yourself?
Not really harming myself. I've never been like a self-harmer. No cutting or anything like that. Just like wanting it to all stop. Basically.
Okay. So, you went to see the counselor, and it helped.
Yeah, I would say so.
Okay. But you never got to a point, it sounds like, where you had created a plan then to end your life.
Not really. I mean, because, like, I've heard, like, the easiest way is pills, and back then I've never been on, like, medication, so I was like, I guess I'd steal my friends, but I don't want to steal my friends, so it was like, my counselor kind of brought up the fact that, like, well, you don't have a solid plan, so maybe you don't really want to do it.
Okay.
And that kind of, like, shook me out of it, you know?
Okay. So, had thoughts, but you had means, but not necessarily thoughts to follow through on it.
Yeah.
Does that sound right?
Yeah.
Okay. What about currently, or when was the last time you were having those thoughts?
Honestly, my last semester of undergrad, so that was about a year ago.
Okay. So, but nothing current?
No, absolutely not.
Okay. And what about any thoughts of hurting other people?
No, I couldn't even imagine.
Okay.
Yeah.
All right. And then you had mentioned that you've never self-harmed or had any thoughts of that?
No.
Okay. So then, just before we wrap up, I want to get a little bit more on your family history. We had talked about your family a bit last week, but I just want to get a little bit more if that's okay.
Okay.
So you were raised by your mom and dad.
Yeah.
What are their names?
Sorry, I don't know why I'm forgetting my parents' names. Carol and Rick.
Carol and Rick. So his brother named after
Yeah.
your dad? Okay. Okay. They've been married, you said, for 25 years?
Yeah.
Okay. What's your current relationship like with your mom and dad and your brother?
It's all, like, fine. I talk to them.
Okay.
It's never been, like, I mean, when my mom was going through, like, because she's not an addict anymore.
Okay.
I guess that's the wrong thing to say. But, like, she's not currently, like, abusing alcohol or anything like that. But she was in the past, and that was kind of rough. And
Sure.
that was, like, after my sister died.
Okay.
Which, I mean, like, as an adult, that makes sense why that would happen.
Okay.
But as a kid, I didn't really understand why my mom was, like, not wanting to hang out and not
Okay.
wanting to be around. So, yeah.
Has that affected your relationship at all now as an adult?
We've had a lot of, like, hard conversations.
Okay.
About that. She's apologized a lot, and, like, I hate that she felt that way. But, like,
Sure.
like having to apologize, but, like, it was good and bad. I mean, because
Okay.
I was glad to get an apology, but also it sucked.
Sure, I can
You know.
understand that. So then you kind of mentioned then what your childhood was like with your mom. It was rough that you didn't really know why she didn't want to be around, and it started after your sister passed away.
Mm-hmm.
How old was your sister when she passed?
She was about 10.
10.
We were, like, 2 years apart. And
Okay.
she died when I was 12.
Can I ask how she passed?
Yeah, it was a car accident.
Car accident.
And her friend's parents were driving, not mine.
Okay, so she wasn't with the family when she passed?
No, we got the call.
Okay.
Yeah.
I can imagine how rough that would be.
That was hard on my family for a while.
I'm sure. So then what about any moves? Any significant moves as a child? Did you move around from house to house?
After she died, we moved.
Okay.
I think that was good, just to get out of that house and into a 3-bedroom house, so there wasn't that empty 4th bedroom.
Sure. Did you move towns?
Yeah, we moved. We, like, originally lived farther south than Chicago, and now
Okay.
my parents live up in Rockford.
Okay.
So.
Sure. What was your family's socioeconomic status?
Middle class.
Middle class?
Yeah.
Okay. We've talked briefly about your sister passing. Any other significant life events in your childhood?
My mom being admitted to
Okay.
the substance use facility.
Okay.
And that was for about, I guess, like 30 days, a month.
Okay. Was she only admitted once?
Yeah.
Okay. So your mom has a history of alcoholism.
Mm-hmm.
And do you know, so it started about when your sister passed. Do you know when she got treatment?
She got treatment maybe like 2 years after.
Okay.
It, like, kind of started, but it took, like, a couple months for it to get, maybe it took, like, a year for it to get bad.
Okay.
And she got help because, like, my dad was, like, talking about, like, taking the kids and leaving, like, that kind of conversation. Even though my brother was, like, older at the time. Like, he was already going to college.
Sure.
But, yeah.
Do you remember your dad having that do you remember hearing your dad say that he was thinking about taking you guys?
Yeah, I was one of those eavesdropping kids because I
Okay.
just wanted to know what was going on. I was, like, pretty anxious. I think I mentioned before, like, after my sister died, it's kind of like
Yes.
middle school,
Okay.
high school is when my anxiety started, so, like, yeah.
Okay. What about any family history of mental health history?
Nothing that I really know of.
Okay. Okay, so really the most significant life events, significant things that happened was the passing of your sister and your mom's substance use treatment.
Yeah.
Okay. Well, that basically completes the assessment for today. I'm really glad that you were able to share a lot of that information with me. You did a lot of great work. I'm really, really glad that you were able to open up with me. Do you have any questions for me before we wrap up?
Same time next week?
Yeah.
Okay.
Yeah, absolutely. We can keep this appointment for you.
Okay.
Because it will work in my schedule, and until it does not work in your schedule, we can keep it.
Okay, yeah, it works good for me. I think it'd be good to have something, like, consistent.
Sure.
So, yeah.
Okay, well then, I don't have anything else for you. If you don't have any further questions, then I will see you next week.
Okay, thank
All right.
you.
Yeah, no problem. And it turned off. Oh.